My name is Susanna and I'm the Social Care Lead for the Trust, and I'm here to talk about approved mental health professionals. Approved mental health professionals came about through the 2007 Mental Health Act amendments. Prior to that, we were known as approved social workers, or ASWs. The amendments in the Mental Health Act in 2007 broadened who could become an approved mental health professional to nurses and OTs, basically registered mental health professionals who went on specific training. The approved mental health professional, or AMP role, they're authorised by the local authority and practice for them, even though they may be employed by the trust or the local authority. And what they do is provide a broad range of tasks, really, under the Mental Health Act and a bit broader than that. What's important is that they are a counterbalance to the medical model that can exist in mental health. They bring a social or a more holistic perspective to mental health work. They may involve nearest relatives and carers, making sure the service users themselves is properly interviewed in an appropriate manner, and ensure that they know what their rights are if they are detained under the Mental Health Act. The approved mental health professional is also the applicant in the majority of Mental Health Act assessments. The approved mental health professional has an overall responsibility for coordinating the assessment. That includes ensuring the principles regarding least restrictive practices are met, that they offer a counterbalance to the medical model that can exist, particularly with the doctors, ensuring that the assessment is done in the most appropriate way, the person is interviewed appropriately, nearest relatives are involved, and the person is conveyed in a humane and dignified manner if they are admitted. The approved mental health professional role is quite different to that of a responsible clinician during a Mental Health Act assessment. They need to consider all the factors that are there to ensure that the least restrictive principle is applied. They also need to ensure that a person is admitted in a humane and dignified way and has access to an independent mental health advocate and all their rights if they are detained.